Understanding the role of the optic nerve in vision. The optic nerve is an essential component of the visual system that is responsible for transmitting visual information from the eyes to the brain. It plays a vital role in enabling us to perceive and interpret the world around us. This video will provide an overview of the optic nerve, its anatomy, function, and common disorders. Anatomy of the optic nerve. The optic nerve is a bundle of nerve fibers that originates in the retina of the eye and terminates in the brain. It is comprised of approximately 1.2 million nerve fibers and is one of the largest nerves in the body. The optic nerve is divided into four sections: the intraocular, intraorbitile, intracanalicular, and intracranial portions. The function of the optic nerve. The primary function of the optic nerve is to transmit visual information from the retina to the brain. This information is carried in the form of electrical impulses generated by the photoreceptor cells in the retina. The optic nerve transmits this information to the brain, where it is interpreted to form a visual image. Common disorders of the optic nerve. Optic nerve disorders can affect the normal functioning of the visual system, leading to vision loss or impairment. Some common optic nerve disorders include optic neuritis, inflammation of the optic nerve that causes pain and loss of vision. Optic nerve hypoplasia, underdevelopment of the optic nerve that leads to visual impairment. Optic nerve atrophy, degeneration of the optic nerve fibers that can result in vision loss. Glaucoma, a condition in which high pressure within the eye damages the optic nerve, leading to vision loss. Diagnosis and treatment of optic nerve disorders. Diagnosing optic nerve disorders involves a comprehensive eye exam and imaging tests, such as optical coherence tomography, OCT, or magnetic resonance imaging, MRI. Treatment options depend on the underlying cause of the optic nerve disorder and may include medication, surgery, or vision rehabilitation. Prevention and care for the optic nerve. There are several measures that individuals can take to prevent optic nerve damage and maintain healthy vision. These include regular eye exams, maintaining a healthy lifestyle, protecting the eyes from injury, and managing underlying medical conditions such as diabetes and hypertension. Conclusion. The optic nerve is a critical component of the visual system, responsible for transmitting visual information from the eyes to the brain. Disorders affecting the optic nerve can result in vision loss or impairment. Early diagnosis and treatment are essential to prevent irreversible damage to the optic nerve. By taking preventive measures and seeking appropriate care, individuals can maintain the health of their optic nerve and preserve their vision.